Hi, I'm Dr. Adam Crane. I'm the clinical psychologist with the Kane Center. And in today's talk, we're going to be discussing mindset and motivation as part of the behavioral change series, the psychological side of weight loss surgery talks. So these discussions are intended to help you with any kind of additional tools from more of an emotional or behavioral standpoint that might make your weight loss a little bit easier and more sustainable in the long run. So with mindset and motivation, there's certain goals that we have in mind that we'd like to achieve during today's talk. So in particular, today's discussion goals include defining mindset. What is it? Why is it important for your success with weight loss surgery? Oftentimes your frame of thinking has a lot to do with your focus on your goals, on your choices, and certainly just as you manage things down the line, including stress or different unexpected challenges that might come up afterwards. We'd also like to explain how the different types of your mindset might impact your weight loss post-operatively. So there's different ways that your framework can be based on your experiences to help you going forward. And we just want to make sure that we understand what are the different types of those frameworks and how they each might have some impact on your success in the long run. The third goal is to illustrate what cognitive pitfalls and behavioral pitfalls might make your post-operative adjustment and your long-term success with weight loss more difficult. Everyone has been on diets before. There's always been things that have come up or things that have made it more challenging to be successful with diets in the long run. We just like to have a different way of thinking and behaving so you don't encounter those same kinds of difficulties. And the last goal that we have is just to find ways to improve your motivation along your weight loss path. You know, most people have enthusiasm for what they're undertaking initially, but it's hard to sustain in the long run. So we just want to make sure that you find some tools or some different ways that you can appreciate what motivation is and how to best apply it as you go through this process. All right, so probably the most important thing to start with here is just defining what mindset is. And in its most simplest form, it's your collection of thoughts and beliefs that shape your behavior. Based on our past experiences, we have different ways that we've learned to view circumstances, view our abilities, and those craft and create your mindset. So if you've been successful with various things, you might have more of an optimistic, positive way of seeing things. If you haven't been, it might be a little bit more negative, it might be more limiting. So it's important that as you go through with the surgery that your mindset is one where you believe in your growth, that you believe that you can achieve your goals, that there aren't the old patterns or the old ways of thinking that get in the way of what you set out to be your purpose with this. If your mindset isn't proper, isn't correct, it may impact your approach to weight loss surgery. Old thought patterns, old stressors do come about, and it might detract you from what you originally intended. So we want you to recognize, how are your emotions? How are your thoughts about your ability? How are they shaping your behaviors, your choices around your eating and your lifestyle after you have the procedure? All right, so there has been a lot of research done, and one of the most prominent researchers in this area is a psychologist from Stanford University. Her name is Carol Dweck, and you can see her book there, Mindset, The New Psychology of Success. And this was done after decades of research, where essentially it came down to understanding fixed versus growth mindset. These are the two main types of belief about someone's framework that kind of help us for the purposes of understanding your weight loss success, how to best approach your surgery. And we're going to get into some details about these in just a bit. But just the overview, fixed mindset is believing that your qualities are unchangeable, that they're carved in stone, that no matter what you do, it'll always be the same way. Versus more of a growth mindset, where this is believing that your qualities are changeable, that who you once were doesn't have to remain that, and that your qualities can be developed based on your efforts. What do you try to put into a situation or a problem-solving approach, and what do you learn from that? And that's more the growth mindset, and ideally, that's what you want to have for this to be most successful with this procedure. And we're going to talk about this in greater detail in just a bit. But as Dweck says in her book, the view that you adopt for yourself profoundly affects the way that you lead your life. So going to the surgery, if you believe that you're not going to be very successful, you haven't been successful with diets, why would this be any different? Then there's a better chance that you won't be as successful with this in the long run. But if your belief is that, I can grow, I can learn, I can make myself changeable, there's a better shot that you're going to be able to be successful with the procedure and with the lifestyle that comes with it. All right, so to get into a little bit more about this. So what the fixed mindset entails. Essentially, the tenets of it is that change is threatening or risky, and it feels easier or just simply safer to stick with a known construct of who you think you are. So it's risky to kind of venture outside of who you've always seen yourself as. You know, for example, if you see yourself as someone who just is bad at losing weight, to be successful might pose a threat. So taking chances and putting forth effort might reveal potential flaws about your identity, who you thought you were, how people now view you. And it's intended to protect your self-confidence. So if you don't take any risks, you never have to worry about failing. You never have to worry about doing things poorly because you're in a safe place. But unfortunately, the consequences of that is that you never see yourself making any changes. So you may be safe, but at the same time, things in your life may not be getting any better. And one of the ways that Carol Dweck studied this was through elementary school children, where it was the kids who wanted to see themselves as maybe not very good students, inadequate in certain ways regarding their studies, because the risk of them studying harder for exams, for example, means that if they failed the exam, even if they tried, would mean that they, at their core, possibly weren't good enough. And that's a big risk. That's something that's very painful to think about, that, you know, even despite your best efforts, you're still not good enough. You're still not capable enough. And so it's just safer to, as the students would do, they fail the test. So if you've ever had a student in your household that didn't study for an exam and you ask them, why not? Well, if the answer is because I knew I was going to fail anyways, what's the point? Why bother trying? That's more of a fixed mindset. It's protective because maybe if they did study and they still failed, it means that they don't have the opportunity to see themselves as being good enough. So taking those kinds of risks can be threatening to some people. But going forth with a mindset like this for surgery and for weight loss, if you don't believe that you can achieve your goal, the chances are that maybe you self-sabotage. Because if you start to make changes, you start to lose the weight. If you don't feel you can sustain it, you don't feel like this is someone that you've ever been being successful with weight loss, maybe you just give up because it's safer to stick with what you don't know, which unfortunately doesn't necessarily lead you to getting any closer to your goals. So that's fixed. Counter that against growth mindset. So what growth mindset is believing that your true potential is unknown. There's no need to stick with a preconceived idea of who you are. But what you need is effort, and that's the key factor here. Effort is needed to find out what your true potential is. There's more of a willingness to grow. There's a willingness to learn. There's a willingness to stumble and pick yourself back up and go from there. Because as you go through the surgery, there are going to be days where you stumble. There will be days where you make the wrong food choice, where you don't exercise the way you intended, where you lose weight and don't recognize yourself from your self-image standpoint in the mirror, but that you give yourself a chance with a growth mindset that that's okay. You'll do better next time. You'll learn from your so-called mistakes, and you just have to keep putting forth your effort to kind of keep trying to get better and better. So growth mindset people, they tend to convert life setbacks into future success. They learn from their experiences and they gain greater clarity from it. This is counter to the fixed mindset where learning from experience means that you have to make changes, and that's scary. So the other main concern with growth mindset, it surrounds you wanting to be have better self-improvement, no matter how many potentially unpleasant or unflattering things that you encounter about yourself along the way. You know, there are some people that don't like to admit that they have certain eating habits. For example, I do encounter a lot of people that are scared to admit that they have emotional eating tendencies, that out of stress, they turn to food, that's their comfort, that's their soothing. As you're limited in using food that way after the procedure, it might expose the feelings of vulnerability, of inadequacy, and it's hard to admit that food was the thing that you most relied on. So, but if you're willing to embrace that, if you're willing to say, you know what, yes, that is who I am, that is how I behave, that is some of the choices, those are some of the choices that I made. With the growth mindset, you know you'll be okay. You'll know you'll grow from it. You'll know you'll be better off in the long run because you'll just keep improving. So let's compare and contrast the two more directly. So fixed versus a growth mindset. And as you can see here, so a fixed mindset person in its most basic form, they tend to avoid challenges. Whereas a growth mindset person, they tend to embrace the challenges. They tend to look forward to them. A fixed mindset person, typically they get defensive in face of setbacks or they give up easily. Because remember, pushing yourself to keep trying means you're just exposing yourself to prove that you're inadequate, that you're not good enough. Whereas a growth mindset person, they tend to persist in the face of setbacks. They look at it as an opportunity to continue to grow. They don't take it as personally that it's something that's wrong with them, but they take it as a sign that, okay, I can keep getting better. So fixed mindset people, for the next point here, they see effort as pointless. Because if you try and you fail, again, it's an attack on your self-confidence, your self-concept. Whereas growth mindset people, as we've been saying, behaviorally fixed mindset people, they do tend to ignore useful feedback from others, and they see it as criticisms. Other people pointing out what they're not doing correctly takes it as a sign that there's something wrong with them. Whereas the growth mindset people, they tend to learn from feedback. They tend to feel that other people giving them suggestions is constructive. They tend to see it as an opportunity to keep getting better. So for someone that they see as being successful, it's that person's successful. So in other words, if they can do it, I can do it. How did they get there? What do I need to do to learn from them and just to keep growing, to not feel defeated? Whereas the fixed mindset folks, they tend to feel threatened by the success of others. There's a jealousy that kicks in because they're actually questioning their own selves. They're making themselves feel that there's just a sense that they're never going to achieve what they see other people do. And so it's safer just to stick with the known quantities of what they've done. All right, so then the question arises, how do you transition from a fixed to a growth mindset for better weight loss success? As you can see, we talked about effort. We've talked about a belief that mistakes aren't really mistakes. They're really more opportunities to get better. And so how do we do that? What's the best way that we can do this so we can be most successful with the weight loss? So we don't see a bad day of eating the wrong kinds of foods, for example, or skipping exercise, for example, as being a failure, as being able to recover from it, to be able to keep getting better and better. So let's talk about that. One of the ways that we speak done is through a concept called mindfulness. And so what mindfulness is, it's just simply a state of accepting your thoughts and your feelings for what they are, not imposing any judgment on them. So in other words, there's no right or wrong way to think about or how to feel in a given moment. It's just living in the present. So being mindful is about not worried about the future thoughts of what's going to go wrong or thinking too far in the past of what you didn't do correctly already. It's just being in the moment of where you are and trying to be also non-judgmental about it. So for example, let's say that after your procedure, you've eaten something that you shouldn't be eating, some trigger food, something that's more of a temptation. You can sit and criticize yourself for it. You can be upset with yourself, disappointed that you failed yourself somehow. But by being mindful, there's an acceptance of it. There's the ability to say, yes, I feel badly about this. I feel guilty about this. But at the same time, I also accept that that's what happened. Once you're able to do that, you free yourself up to be able to move forward, to be able to not try to repair your self-concept, not to repair your ego, but being able to be accepting of it and just say, you know what do I do about this now? Once you give yourself that kind of forgiveness, stop imposing the judgments, you free your mental energy essentially to try to make different changes. So oftentimes with the weight loss surgery, what we find is that a lot of patients, they're too focused on the long range goal of their weight loss totals, scale numbers, just instead of how they're doing in the moment. And it tends to lead to a lot of distraction and less mental energy or focus to be able to do what they can at those times. So if you have a goal of losing 100 pounds, for example, and you had a bad day and you're not focused on the moment and you're more worried about what you're going to be doing wrong, you'll probably be demotivated. You'll probably give up. There's less of a drive to want to keep achieving. But if all you can control is that exact moment, making a better food choice. If you didn't go to the gym to exercise, get yourself there then. Doing things, making an action plan helps with improving your progress, because all we can really change and all we can really manage for the time being is just the moment. There was a study done in Eating Behaviors Journal, and what the study shows that patients with higher degrees of mindfulness, they were able to lower their episodes of things like binge eating, emotional eating, grazing behaviors. So acting with awareness strongly correlates with problematic eating. If you're not focused on what the moment is, you're more distracted. You might be making worse food choices because more emotion is going to be coming to the surface. There might be more anxiety, there might be more guilt. And if you're an emotional eater, you're going to turn to food as a way to cope. But if you're more present, you're more focused on just the moment, you accept the anxiety, you accept the feelings of guilt that may be there, you have a better chance of just knowing what you can do about that differently and not trying to eliminate it or distract yourself too quickly without being mindful. Furthermore, along these lines, if you have more of a fixed mindset in this regard, it's going to prevent you from exerting the effort that's needed for getting your desired success. If you tend to feel more overwhelmed, you tend to feel more defeated, that may be more signs that you have more of a fixed mindset at play. The growth mindset concept would be that you're more encouraged, that you say, you know what did I take from this experience that I can do better for next time? And some of the ways you can even do that is not as much focus on the goal, on the scale as your goal, but what has been going well so far. Give yourself some positive regard. What are some better choices you've made? So for example, if you had 3 bites of something that you shouldn't have eaten, be glad you didn't have 4 bites. Be glad that you stopped yourself when you did. There's victory in those kinds of things. Now, I was hinting at this before with the mindfulness concept, but another idea that goes hand in hand is the idea of what's called radical acceptance. And what this is, it goes with mindfulness. It's a skill that helps people who experience difficult situations or intense emotions just to accept the reality. So this is what I was saying earlier, that if you feel guilty or you feel ashamed of choices you've made, or you feel frustrated that you haven't lost the weight that you thought you might, radical acceptance means that you're just able to accept that feeling at that time. It may not be the most pleasant experience to accept, but it's your reality. It's just how you feel. You can't try to deny those feelings that they don't exist. You need to know, in other words, let go of your rigid patterns, stay focused on what matters the most. Keep your goals in mind. You know, once you accept that, yes, I feel guilty, or yes, I feel ashamed, or yes, I feel frustrated by whatever isn't going the way I was hoping it would, you ask the question, what is it that I want to do about this? What is it that I can do about this? So if the belief is that you just need to give up, see, there it is, I can't lose any weight, I'm not going to be successful, let go of that rigid pattern. Ask yourself, what matters the most? What am I going to try to learn from this experience? That's what helps you shift from the fixed mindset to more that growth mindset. And the psychologist Carl Rogers, he has a quote that I like to use quite a bit. And he said, the curious paradox is that when I accept myself just as I am, then I can change. When we try to deny who we really are, we're spending way too much mental energy trying to be something we're not, which takes us away from the goals of what our potential can be. All right, now some other ways that we can try to get ourselves to transition and to be more motivated is an idea called self-efficacy. And what self-efficacy is, it's the optimistic self-belief in your competence or your chances of successfully accomplishing a task and producing a positive outcome. Okay, so based on your dietary history, how confident are you in your chances of success with the surgery? Why is bariatric surgery going to be any different than any effort you've ever made with diets? And this is a common thought that a lot of people have, this belief that because they've been on so many diets, nothing will work. Therefore, if you go into the surgery with this idea that nothing's going to work, then nothing's going to work. You will find ways to make it so that you aren't as successful as you can be. Just from a behavioral standpoint, yes, you'll lose the weight, but will you be able to sustain it and keep it off? But this idea of self-efficacy, if you find something within yourself that you are competent, that you are capable, that you can be successful, In other words, that growth mindset. How do you apply it? What are some ways that you can start to see that you are going to do differently than you did with diets? So there are 5 ways that you can try to improve your self-efficacy. And these are meant to be strategies to kind of shift your thinking and your ability to see yourself as potentially more successful. And the first one that we can see here is mastery experiences. This is the actual experience in overcoming obstacles. Have you done it before? If you've lost weight before, for example, you know you can lose weight because you've done it. You have evidence, there's proof. So that's one way to do it. Any skill that you try to tackle, if it's a new job or anything else where we question our abilities, we look at the mastery experiences. What have I done well in a job that's similar to this that can be transferred over to this experience now? And if we say, you know what, I've done this before, or this looks familiar, I think I can achieve this, we have a much better way of being successful. The second method here is called vicarious experiences. And even if we don't have any particular mastery or real world experience ourselves, vicarious experiences suggest that by seeing others being successful in a similar situation gives us confidence that we can be successful. So I guess saying earlier with the growth mindset, that you see the success of others as motivating and as possible. So by looking at other people in similar circumstances, there's a trust that you can do it too. So even if you don't have any real experience, and a lot of people don't have any real world experience with bariatric surgery, this is something that you might just be encountering for the first time. Maybe you know someone who has been successful. Try to look off of their experience of what they've done well, or even maybe what they haven't done well, and trust that you can build on that and learn that you can do something differently or similarly for yourself. The third form of self-efficacy, third concept, is called verbal persuasion. And there's an increased likelihood that you're going to try something if other people believe in you. And we have an entirely different group topic about support systems and how to get the most out of the people around you to help you, encourage you, and to make you feel supported. But with verbal persuasion, it's important that you have positive people in your world, people that believe in what you're trying to do, that you can trust, that you can feel supported by. Because by their verbal persuasion, by their encouragement, it increases the likelihood that you're going to try something for yourself, that you're going to keep yourself motivated. The fourth concept is imaginal experiences. And even if you don't know anybody, even if you've never been through any of these experiences for yourself, imaginal experiences, it helps you to have a better chance for success if you can even imagine yourself being successful, if you can visualize it, if you can close your eyes and see yourself crossing the finish line, that you're going to be successful with your weight loss, or even if you picture yourself engaged in some particular task. I know some people like to run 5Ks. They've never been good at running before. They've never tried it, but they can picture themselves crossing that finish line with their arms up in victory. If you can imagine yourself doing it, you have a better chance of being successful because there's an encouragement there that develops. And that comes from being open to new experiences and not feeling threatened by the chance of what if you don't finish the race? Well, maybe it just serves as good training for next time that you want to give it a shot. Maybe you just build on it gradually. The last concept here is emotional and physiological states. So this is just simply put that the more positive your emotions are, that tends to increase your confidence. The more negative your emotions are, it tends to decrease your confidence. Very simply put, if you're more depressed or anxious or overwhelmed, there's not as much of a chance that you're going to be as successful because you're not going to feel very confident or very secure in knowing that you can get something done. But if you're more hopeful, more optimistic, happier, you have an increased confidence. You have the belief that you can get something done. And this is where also mindfulness does help. Because by being more mindful in those moments, let's say you are worried about a circumstance. Well, by being more mindful, you decrease the future worry about what can go wrong. You know, when we worry about things, it's always the concern that things won't work out, that we don't have the necessary tools to be successful. But by being mindful, we don't have to worry about the future. We can be more present with, I'll cross that bridge when I come to it. I'll learn the tools necessary that I don't have right now. But we'll be able to kind of say, for right now, this is all that I can do. And based on that, we can prove to ourselves that we can be more successful. because the smaller scale means that maybe we achieve that smaller concept, and then we can keep building, and more smaller victories means much more future vision on future victories, and our confidence goes up. So we can do that with weight loss. We can do that with food choices. We can do that with new lifestyle. We may not know what it's going to be like for us losing a lot of weight with the procedure. What we do know is that by making better food choices today, right now, we set ourselves up for a better option at the next meal, the next day, and we keep building on that progress. And so eventually when we do lose the weight that we want or live the lifestyle that we want, it's a lot easier for us to feel that we've achieved something big. So more specifically, how do you change your self-efficacy? And this is also along the lines of how do you shift from more of that fixed mindset to that growth mindset? So you change your self-efficacy in a few ways. Like I was saying before about being present in the moment, you go small. Don't create goals that are too big for yourself, because being too big with your goals means it could be demotivating. It could be just proof that we're not going to be successful because we can't achieve the goal. So in other words, if you want to lose 100 pounds in a few weeks, that may not be very realistic. And as a result, you may feel defeated. You might give up easier. So set smaller goals. Lose 15 pounds over the course of 2 weeks. Lose smaller increments of 15 pounds, 20 pounds, and eventually you'll hit the goal that you want in the first place. But by starting small, it helps you to measure your progress towards your goals a little bit better. It strengthens your self-perception. It helps you to take notice in mini accomplishments, or what we would call more non-scale victories. So it doesn't even have to be about your weight loss. Small goals can be things like just stopping yourself from finishing everything on your plate. It could be about organizing your meals better. It could be about going grocery shopping and choosing the right items that you need for better meal planning later on. There's all sorts of ways to measure small goals that lead to success. You know, it may not be going to the gym and running a mile on the treadmill. It might just be putting on your gym shoes, and that's a start. It could be just driving to the gym and walking around and checking out the equipment. That's a start. But little by little, you start to build on those smaller victories, and it becomes a little bit easier to keep going. Some other ways to change your self-efficacy include like the vicarious experiences, watching other people. We learn from our own behaviors as well as from the behaviors of others. So if other people aren't successful, what did they do that you can do better? Or what didn't they do that you can do better? It might actually serve to reinforce some of your decisions. If you see someone being successful, it will allow you the chance to continue and to have an external measuring stick about the way this is supposed to look, the way things are supposed to be from a success standpoint. One of the other things that I encourage a lot of patients to do as they go through the weight loss process is there's sometimes a lot of fear and worry about sustainability. Can I sustain the goals that I set out for myself? Will I be able to keep this weight off? And one of the things I like to encourage people to do, and this helps with self-efficacy, is essentially look back. Reflect on some of the things that you've already done well. A lot of people don't give themselves enough credit of some of the things that they've built as far as tools to be successful. You know, they worry about being able to keep the weight off because they don't know what they've done already to be successful with what they've achieved so far. So build a catalog of past positive experiences, times that you have chosen the right food, that you've limited your quantities, that in light of certain stressors, you chose a different coping mechanism than eating if you are a stress eater, anything like that, for example. But build up a catalog of things that you know you've done well, that you can't dispute, that helps you to kind of move forward. Another thing you can try to do is just properly interpret your emotional states. You know, be honest with yourself about how you're really feeling about circumstances, your mood around that, your emotions, your stress levels. These can all have impact on your eating habits, on your choices. They can also have impact on your desire to keep fighting forward, to keep achieving goals. So if you're honest with yourself, if you're feeling overwhelmed, find the solution to feeling overwhelmed. Don't just give up. So take inventory on what it is that you can do based on how you really feel about a situation. If you try to deny it for yourself, if you try to push back and have that fixed mindset that you're not really feeling what you're actually feeling, you might try to give up just as a way to preserve a little bit of integrity. But if you're willing to make changes, if you're willing to have that growth mindset, that belief that, you know what, it's okay if I'm not proud of what I'm doing, it's okay if I question myself, it gives you the opportunity to create a better plan of action. So with that, as far as talking about motivation, this is a key factor in trying to be successful. This is a key thing to be able to say, you know what do I need to do to sustain success? And with diets, it's not as easy to do. There's a lot of times where we run into challenges in life that cause us to give up on the diet. And I know a lot of people don't want to keep doing that as they go forward with the bariatric procedure and with the lifestyle. So let's try to understand motivation, understand how it has impact, what it does to actually maybe demotivate us, and how we can sustain greater chances of our efforts. So to start this part off, let's talk about the motivation myth. And what a lot of people believe with motivation is that they just wait for the right time to get started. The motivation myth says there actually is no right time to start. Waiting for the right moment to do something means you'll be waiting for a very long time. In fact, it's actually a form of procrastination. And a lot of people kind of believe that procrastination is more of a deficit of time management, where actually what procrastination is, it's a deficit in emotional management. You know, when we push things off, the message we're really saying is not that we don't have enough time. What we're really saying to ourselves is that we don't feel confident that what we're going to try to do is going to work out. So we procrastinate. Therefore, we're not really motivated to do it. But if you accept yourself as you are, you accept yourself as you'll get out of it what you can, you'll be more motivated. There'd be more of a belief that it's okay, that even if you don't achieve the goal, even if you don't run that mile that first day, that at least you're on the path to getting there. So the key to motivation is effort, but only deliberately acting again and again will lead to mastery. So do your best, be present, and just try. If it doesn't work out, you'll learn as to what happened, what went wrong, what do you need to do better. And if you keep trying over and over again, eventually you'll feel more motivated. So setbacks can be opportunities to learn. They can be chances that you can improve on. So just keep trying and keep putting yourself in more of a vulnerable place to try to learn from what your past actions will teach you. So along the lines of motivation, some ideas, some concepts to keep in mind here. Remember that mindfulness actually increases the available mental energy to achieve your goals versus being distracted by what you have to do later on. If you're too distracted by what's going on later, you're going to be overwhelmed. You might feel just disinhibited. You may not, or inhibited rather. You don't want to try. You don't want to keep pushing yourself forward because that which looms ahead keeps you stationary. You also want to try to gradually increase the difficulty of your goals over time. If you lost 5 pounds, for example, with relative ease, maybe increase the goal to 7 pounds, 8 pounds, 10 pounds. Because if you set your goals too low and they're too easy, you won't be as motivated to keep trying, but you do need to get enough success to try to build on that. So gradually increase the difficulty of your goals to kind of build a sense of pride and accomplishment. Try not to multitask. So if you tend to multitask, it serves as a demotivator. People tend to get overwhelmed. They tend not to have the right mental resources to be able to move forward. So keeping your goals relatively straightforward, relatively simple. You know, keeping a schedule as far as what it is that you need to do to get forward and to do well. So if you find that you've got too many things going on, you're going to be spread too thin and you're not going to be able to maybe achieve the primary thing that you were hoping to. Another pointer here is avoiding negative self-labeling. Now that's a concept that's pretty familiar with people with fixed mindsets. I'm bad at weight loss. I can't do this. things that feel that they're not good enough or they don't trust their abilities. So if you apply a negative label to yourself, you're more likely to give up. It's just this idea that there's no room for growth if you are one very specific rigid concept that you put on yourself, a negative idea. So for example, if you say, I'm just bad at dieting, there's not much room for improvement there. If it's, I'm bad at dieting when there's my favorite foods in the house, it's a condition. Gives you an opportunity to change the condition by getting rid of maybe some of those foods in the house. So try to avoid the negative self-labeling as a way to improve your motivation. And like I was saying before, for motivation, try to relabel your mistakes as opportunities for growth. If you see your mistakes as mistakes, maybe you don't want to feel that you've done anything wrong and you'll give up. But if a mistake is just an opportunity, maybe you'll keep motivating and be motivated to move forward. So I like to use the example of Thomas Edison. I mean, I have to imagine that after he made one light bulb, if it didn't work, can you imagine if he gave up? Probably gone through, I don't even know how many, several hundred prototypes before he finally came to the light bulb that worked for him, that worked for all of us. So keep trying, keep building on what you've already done. There's a quote that I'm familiar with by Henry Ford that states, whether you think you can or think you can't, you're right. So in other words, if you're negatively labeling yourself, if you're doubting your abilities, if you're stuck with that fixed mindset, if you think you can't do something, then you're probably right. You probably won't do it. But if you believe that you can, even if you don't know how, but you just have to focus on the next step in front of you, then you'll be able to achieve whatever it is you set in front of you. Also, challenge your excuses with what you know that you can and what you will do. A lot of times we default to why something can't work or why we won't do it. But if you challenge your excuses with what you know and what you can do and what you're going to commit yourself to doing, then it'll work out better. So for example, for exercise, you commit yourself to going to the gym or to exercising the next day at 10 o'clock, you'll do it. No excuses. You'll make it easier for yourself to be, if it's written down, you'll get there. Other things that help with motivation, and this is especially true as you go through with weight loss, is create concrete plans with specific details. The more vague something is, the less likely it is that we're going to engage in doing it. So of the concrete plan, it's more of a specific blueprint. I was just saying a moment ago that if you're going to the gym at 10 o'clock on a Wednesday, that's specific. When you get there, you're going to go on the treadmill for 15 minutes. That's specific. It's a lot harder to deviate if it's something that's outlined for you. You can do this with your eating plan as well. Plan your meals ahead of time. That's why that's important. Know what it is that you're going to make. How many times have you been caught off guard in the moment where you're hungry and you just grab anything you can think to grab because it's just faster and easier? If you create a concrete plan, if you organize your meals, if you plan them out ahead of time with specific details, specific portions, it makes it easier to stick with what's the right course. Try to be constructive, avoid self-criticisms. It's natural for us to be down on ourselves at times, but just try to catch yourself in those moments and even write down what's something that is a positive of what you did. And that's where I like the idea of even like journals, writing down your goals and your achievements. Beat your personal best, beat your records, give you some hope that the hardest parts are already started if it's written down, if you've already seen what you can achieve and what you've already started to do. Sometimes it helps to keep you moving. Other motivational techniques are to use photo journals. You can take a picture of yourself maybe on a monthly basis just to kind of give yourself a little bit of encouragement to see your weight loss progress. If you have any self-doubt that you're not losing any weight or you're not doing very well, look through some of the old photos, look through some of the things that you've already done, look through some of the ways that the stages you've already passed, and you can see as you look in the mirror, you've achieved something. The old photos, maybe you were a lot heavier is what you see in the mirror. It gives you some more of a concrete verification that you're doing something the right way, that you're making progress. And other motivational techniques, just Set reminders on your phone, write them down on the calendar. Have an accountability buddy, have somebody that you can call that you can count on that's going to help you to get to the gym or help you to plan meals effectively or keep you on track with your weight loss in general. Some more specific details that I would encourage you to try to do with a motivational plan is you can ask yourself a variety of questions. And this can be done at the end of your day, the beginning of your day. But if you address some of these questions, it helps you create a little bit more of a framework to be successful and to want to keep moving forward. So ask yourself things like, what are the opportunities that I have for learning and for growth today? What is it I'm trying to achieve? What is it that I can see as something to look forward to in the middle of my day? You can ask when, where, how will I embark on this plan? You might feel overwhelmed by what opportunities are out there, but you're not quite sure what to do about it. Well, by creating a specific idea about when and where and how and what resources do I have to get started with this helps. Once you're done with your day, once you're done with your goals, your experience for growth, what did you learn from your setbacks? This will help set you up for the next day when you want to try to encourage yourself to keep moving forward and to improve. You can even ask yourself things like, do I have a new skill set today that I didn't have before? So in those long range times when you're doubting yourself or you're worried about not continuing to lose weight, or what if you regain weight? Well, if you've already developed a skill set and you have it documented, you'll have more confidence to know that I have a set of tools to help me sustain this. So what new skills do you have today that you never had before? Well, each time you do it, you'll keep building a bigger and bigger toolbox. And one of the last things you can ask yourself is, did I put forth my best effort? And it's really okay if you don't, but you want to ask yourself, why didn't I? Or if you did, why did I put forth my best effort? What was I trying to achieve? What was I trying to prove? So why or why not? Did I put forth my best effort? Is there anything I can do better about it the next time I try this? What were the obstacles that got in the way so I learned how to do this? There are studies that show that the more obstacles that we have in our way, the less likely it is that we're going to try to achieve any goal. So maybe your best effort was hampered by some of these obstacles. Are there better ways to take those obstacles out of your path? In other words, if you're trying to plan a meal and you don't have the right ingredients, that's an obstacle. How do you get those right ingredients in the house? How do you get them to a place where you're feeling that now you have the right tools necessary to put forth your best effort? So there are certain things that do cause people who go through the bariatric surgery to be demotivated, to default back to a fixed mindset if that's something that they started off with. And I want to go over a few of those with you here. So part of it is that there is a frustration sometimes over not losing enough weight. Now, what's enough weight? If you had a preconceived idea about how much you thought you were going to lose and you don't achieve it, that could be frustrating. So it can also, with frustration, there could be a sense that you don't know how to bridge that gap between where you want things to be and where they are. So if you get too frustrated, there's a chance that you may give up. So what you need to do is find a way to be mindful, radically accept that you are frustrated, but in so doing, find ways that you can bridge the gap between what hasn't happened yet and where you are. So if you're frustrated over not losing enough weight, for example, okay, what is it that you need to do to modify your expectations? Do you need to change your time frame? Maybe the time that you wanted to lose this weight wasn't enough time. Maybe you need a little bit longer. It doesn't mean you won't hit the goal, but you just need longer time to do it. Maybe you need to modify the amount of weight that you intended to lose. Why is that amount of weight important? Are other parts of your life better, even though you haven't hit that goal weight that you had in your mind at the outset? Maybe you're feeling healthier. Maybe you're still feeling more active. Maybe you're more energetic. You're taking on different challenges, even though you hadn't hit that specific scale number. Those are those non-scale victories that we talked about a little bit earlier. So try to improve your motivation by finding ways to measure your success differently versus just what the scale might read. Another bariatric demotivator is difficulty accepting your new self-image. And this can go in a way where people have a sense of how they think they're going to look once they've lost weight. If it doesn't match with how they thought, they may feel self-conscious. They may want to give up. They may want to go back to the old ways that they were eating because they just don't, they're not used to how they look. They're not happy with it. But if you can gradually learn to accept your new self-image, and this is where those photo journals might help. Sit with a picture, learn to accept kind of where you're at. It makes it easier for you to get there. You know, your weight loss is a lot faster than what your mental adjustment will be to how you look afterwards. Other demotivating factors might be negative feedback from other people. So we were talking about self-efficacy earlier, that if you have positive regard and positive support from people, it tends to be more motivating. Negative feedback from other people can be demotivating. It can mean that you're not feeling very supported. It might cause you to question, why am I doing this at all if no one else really appreciates what I'm trying to achieve? So you want to try to surround yourself with more positive people to the best that you can, or people that at least try to understand and support what your efforts are. Along with that, too much positive attention can actually be a demotivator. There are a lot of people with weight issues that are very self-conscious, don't like the idea of being in the spotlight, and certainly losing weight quickly can put them in the spotlight. It can make them feel that they're being noticed more often. People asking questions, how did you lose your weight? What are you doing? Are you sure you should be eating that? You know, different things that people may not understand, but it makes the patient feel more uncomfortable. So too much positive attention might be something that is a way to push people's questioning or their focus away from them. They may stop their weight loss. They might self-sabotage. They might go back to old ways of eating because it was just safer. There's a weight stigma with some folks. Then they've learned to be more on the fringe versus in the center. Too much positive attention actually also, it gets people sometimes to question whether or not they can keep going forward because they don't want to let other people down. If people are too overly praising, now the patient feels there's an obligation to keep that person proud of them. And as a result, they might stop trying as hard because they may doubt themselves. They may doubt that they're able to try to please everybody all the time. So negative feedback or too much positive attention can be a demotivator as well. And lastly, just familiar triggers or stressors that feel unmanageable. There's sometimes where we're just blindsided by life events that we're not prepared for. We might go back to some old eating habits as a way to cope. We might give up on our efforts to try to keep losing weight or living the new lifestyle. So familiar triggers and stressors are things you want to be aware of, know how they impact you, and know ways that you can counter those with either some mindfulness or some radical acceptance, and just maybe a specific plan about how you're going to sidestep them if they do come up in the future. So with that being said, hopefully you've learned a couple of things about how you can change your mindset, how your point of view will actually either encourage or discourage your weight loss efforts or your new lifestyle, your self-acceptance. And you can find ways to change from that fixed mindset to more of a growth mindset, to believe that no matter what you're doing, there's always something to be gained, there's always something to be learned, and a better way that you can approach a problem. But you can't do it unless you have the experience in which you've just been through. So take stock, take inventory in what you've done. Everything has a possibility for learning, and you just have to be open to it. And hopefully with that, you'll be able to be as successful as you possibly can with the surgery. And hopefully just you'll achieve the goals that you set for yourself, but even discovering and creating new goals for yourself along the way that you weren't even aware of in the first place. That's all for our talk today. I hope you enjoyed it, and best of luck with your journey.